Hello, welcome back to my channel. Today I would like to continue to discuss my perspective on becoming a psychiatric nurse practitioner. Whenever you practice as a psychiatric nurse practitioner, you're caring for the lives of others. And a lot of times, if you're working in the inner city or in the rural areas, you're caring for marginalized, vulnerable populations. So you need to make sure you're competent and proficient. It's not a joke. Okay, it is not something it's not a field you come into just to make money because you're caring for people's lives. Again, a lot of these patients are vulnerable. They're marginalized citizens in society. A lot of them are minorities. It's not a joke. Let me tell you something. I've had patients, and I've seen a lot over the years, but I've seen it more than once. A patient will want to see a provider, if whether it's a nurse practitioner, if whether it's even medical doc, not so much medical doctors, but I've seen it with nurse practitioners, in particular. They won't come. A lot of these patients will ask to see the nurse practitioner, the psychiatric nurse practitioner, and they will not come to see the patient. And that's not right. It is not right. So if you want to become a psych NP, you need to care about people. And you need to know your meds. It's not a joke. You can't come into this profession not knowing your medications, not knowing your psych meds, not knowing your regular meds. And if a nurse calls you to tell you that the patient is symptomatic, you just going to just prescribe something without even looking at the patient's medical history, without even coming to see the patient, examining the patient. That is not good practice. So if you want to become a psych NP, you need to, number one, make sure you're proficient. Number two, you need to care about people. And number three, which is most important, which is really number one, you need to know your meds. And that's first and foremost because you're caring for a person and you're dealing with a person's life. Alrighty, guys, just want to say that because I'm going to just speak it, tell the truth, because it is what it is, right? And I'm not going to sugarcoat it because I've seen a lot and I'm going to say something. When you see something, you got to say something, and that's the only way things will change. Alrighty, guys, thank you for watching. Remember, subscribe to my channel if you haven't done so already so you can be updated when videos are posted. Take care, guys. Bye-bye.